No, you absolutely cannot get COVID from the vaccine. The way the current vaccines that are being developed are manufactured is they take a fragment of genetic material from the virus. So it's not even the entire virus. And this fragment of RNA is actually injected into us. So there's absolutely no live virus that's given to us, or even a whole virus, even an inactivated virus. So it's really just a fragment and should be perfectly safe to receive. Now, it does have some side effects. It's an injection in the arm. You can have a sore arm for a couple of days afterwards. Some people feel a bit fatigued, a little achy, but that's something that should be able to be relieved easily with ibuprofen or Tylenol or something like that. So it's a very safe vaccine. So the number of doses of the vaccine depends actually specifically on the vaccine. The two that we have that are closest to being in widespread use both require two injections. The Pfizer vaccine, which is the one we believe we'll be having first, has two injections 3 weeks apart. And then there is a second vaccine that we may be getting, a Moderna vaccine, that has two injections 4 weeks apart. If you miss that second dose, you really will not get full immunity. Both vaccines are about 95% effective if you get two doses, but like any other vaccine that requires more than one dose, if you only get one and you miss the second one, you may not actually achieve full immunity. So we really recommend that even if you should miss it, that you have a catch up and you get it at a later time. We really don't know. All we can extrapolate is that for most infections, if you get it naturally, you are immune to it and you don't have to get it again. But with the coronavirus, we really aren't sure. Just as with influenza, you can have influenza 1 year and you still have to take the shot the next year. That may be the case for the coronavirus vaccines. We just have to wait and see. So that's another great question. This vaccine has really not been around long enough. Actually, even COVID-19 has not really been around long enough. We don't have years of experience. We're hoping it's prolonged at least for several months or even longer, but we just don't know yet. That's why studies are continuing. You absolutely should not change any of the protective behaviors that you mentioned: masks, social distancing, hand hygiene. We know that after you get the vaccine, you're not fully protected. It can take, as I said, that second dose. And even then, we're still not talking about 100%, which is really what you would need to be able to forego any of these measures. So we really need you to protect yourself and protect others. And this is a vaccine that is made of fragment of RNA from the actual COVID-19 virus. So it's not actually grown in any kind of cellular media. It's not grown on germ cell lines. There's no aborted fetal tissue that was used years ago to grow some of these cell lines. Some vaccines have used them, but this vaccine absolutely does not use them. There's no cells of any type in this vaccine, which is why it's a really clean vaccine that should have a minimum of side effects. So pregnant women, we know, can come down with the virus. And in our division, we've seen some very horrible cases of pregnant women who have developed severe pneumonia due to COVID-19. Although there were no pregnant women in any of the vaccine trials, the vaccine seems to be extremely safe. The Society for Maternal Fetal Medicine has come out with a statement saying that pregnant healthcare workers should not hesitate, but should actually receive the vaccine along with all the rest of our colleagues. Well, that's a great question. So as I mentioned, the vaccine can give you some mild side effects temporarily: sore arms, some aches and pains. Most of the time, I think you'd be able to get over this with just some over-the-counter pain medication, fever-reducing medicine, should you happen to just not feel very well. If you're really so sick that you just can't come to work, well, of course, you'd be taking PTO, but we really don't expect too many people to have that. And if you are one of the people who are maybe concerned about it, schedule the vaccine for a day prior to when you're going to be off. This way you don't have to worry about it interfering with the work schedule.